Hi, everyone. Welcome back to the Philly Jenkins Rescue YouTube channel. My name is Mimi, and I'm the founder and director of Philly Jenkins Rescue. For anyone who may be new here, Philly Jenkins Rescue is named in honor of two very important animals in my life. My dog, Dr. Phil, aka Philly, Philly Boy, Philly Cheesesteak, and many other names that he had over the years, whose passing inspired me to begin this rescue journey, and Mr. Jenkins, the neighborhood cat, who became one of the first cats I rescued after my dog passed away in December 2023, and the heart of the organization. I also have another kitty named Peppa Sissy Pear, who is a Maine Coon mix, saved before euthanasia a year ago from the Stanislaus Animal Shelter, who we are rescue partners with. I wanted to share both of their stories in another video, but for this video, I want to update the rescue community on how Mr. Jenkins is doing and explain the surgeries he recently went through, a total of 4, and what his final results showed, and talk honestly about how this entire process felt for me. Mr. Jenkins, who is 10 years old now, is not just the face of our rescue, he is my family, my companion, and the reason this organization exists. So when I learned that he had developed mast cell tumors, it was frightening. Mr. Jenkins has a history of multiple cutaneous mast cell tumors. Cutaneous simply means that tumors develop in the skin. Mast cells are normal immune system cells that originate in the bone marrow. They play an important role in inflammation and allergic reactions. These cells contain granules filled with chemicals such as histamine, serotonin, and heparin. When mast cells grow abnormally and form a tumor, those substances may be released into the surrounding tissue or bloodstream that can potentially cause redness, swelling, irritation, gastrointestinal symptoms, or an allergic type of reaction. In cats, mast cell tumors can generally occur in 3 different forms: in the skin, in the gastrointestinal tract, or internally in the organs such as the spleen and liver. Many feline skin mast cell tumors behave relatively benignly and can be successfully treated with surgical removal. But because Mr. Jenkins had developed more than one skin tumor, his veterinarian needed to investigate whether these were isolated skin tumors or whether mast cells might be present internally. That uncertainty was one of the most frightening parts of his journey. On June 6th, a mass on the right side of Mr. Jenkins' abnormal wall was sampled through a fine needle aspirate. A fine needle aspirate involves placing a small needle into a mass and collecting cells that can be examined under a microscope. The cytology identified the mass and a mast cell neoplasm. On June 15th, the mass was surgically removed and submitted for a full histopathology examination. Histopathology is different from cytology. Cytology examines individual cells, while histopathology allows a pathologist to study the structure of the entire piece of tissue and determine the tumor's grade and evaluate the biological characteristics and check whether the surgical margins are clear. The final pathology identified it as a low-grade cutaneous mast cell tumor. Its mitotic count was 1. A mitotic count measures how many tumor cells are actively dividing under the microscope. In general, a low mitotic count is more reassuring than a high one. Most importantly, the report said that the excision appeared complete and the nearest peripheral margin was 4 millimeters. The deep margin was 6 millimeters, and no vascular invasion was observed. In other words, the pathologist did not see tumor cells extending into the blood vessels, and examined edges of the removed tissue were free of tumor. When I received those results, I was relieved, but the process was not over. Because Mr. Jenkins has a history of multiple skin and mast cell tumors, he was evaluated by the oncology department at SF Animal Medical Center. His oncologist explained in some cats, the spleen can potentially act like a mothership, with mast cell tumors in the spleen associated with additional tumors appearing elsewhere, including on the skin. This did not mean this was definitely happening to Mr. Jenkins. It meant we needed to investigate to possibly find more carefully. An abdominal ultrasound was performed to examine his internal organs. One thing I learned during this process is that the visual appearance of the spleen on the ultrasound does not always provide a complete answer. A spleen can appear relatively normal while still requiring cellular evaluation, which is why the oncology team is also discussed aspirating it and examining cells microscopically. The ultrasound identified a renal cyst, but it was considered benign. At that point, we were facing difficult decisions while still not knowing whether his disease was limited to skin or involved in the internal organs. As his person, this was emotionally exhausting. There is something especially painful about trying to remain calm for an animal who trusts you completely while you are terrified inside. Mr. Jenkins could not understand the medical terminology, and he did not know why he had to go to so many appointments and why he had to be completely shaved and why people were examining him or why he had to have back-to-back surgeries. All he knew was that I was there. I felt responsible for making the best decision possible for him, even when I felt no option left emotionally easy for me. I kept asking myself whether I was doing too much or whether I was doing enough, and whether I was making the right choice. I also knew that if there was a possibility of internal disease, I could not ignore it. Mr. Jenkins ultimately went in a splenectomy, which means his spleen was surgically removed. During the diagnostic process, tissue from his liver was also collected for examination, and another small skin lesion was submitted to pathology. The spleen supports blood filtration, immune function, and the recycling of aging blood cells. However, cats can live without a spleen because other tissues and organs can perform many of its functions. A splenectomy is still major abdominal surgery. It requires anesthesia, careful control of the spleen's blood supply, removal of the organ, and close monitoring afterwards for bleeding, pain, changes in blood values, infection, and possible complications. Waiting during the surgery was incredibly difficult. Mr. Jenkins has survived so much already. He survived years outdoors. He learned how to trust people, and he became a wise old man of our rescue and the cat who quietly watches everything I do. The idea of losing him was overwhelming. I tried to prepare myself for possible results while still hoping that we would receive good news. Thankfully, Mr. Jenkins made it through surgery, and then we had to wait for the final pathology, a whole 10 days. They removed the spleen. The removed spleen showed moderate widespread congestion, but pathologists described that as a nonspecific finding that may be associated with changes occurred during anesthesia. Most importantly, there's no evidence of neoplasia in the spleen. There was no evidence of a cancerous mast cell population, hemophilia cancer, or vascular cancer in the tissue that was examined. The liver biopsy showed a condition called vascular hepatopathy, which means that the liver cells had developed nonspecific changes within their cytoplasm. These are several possible causes of this type of change, so the finding has to be interpreted alongside the rest of his clinical information. But the most important result for his cancer evaluation was that the pathologist found no neoplastic cells in the examined liver sections. The additional skin lesion removed during that process was not another cancerous tumor. It showed inflammatory changes involving eosinophils and mast cells, with a hypersensitivity response considered the most likely explanation. No infectious organisms or neoplastic cell population were observed in that sample. Hearing that his spleen and liver did not contain cancer, we feared was an enormous relief. I feel like I've been holding my breath throughout this entire process, and I can finally exhale. Mr. Jenkins's recovery has been gradual, but he has been doing well. After major abdominal surgery, recovery is not always dramatic. Sometimes progress looks very quiet. It looks like eating another meal, getting up, walking around, using the litter box, and choosing a comfortable place to sleep, and coming to sit beside me again. Mr. Jenkins has been eating very well, and his incisions have continued healing. He has been moving around the house, and he has never been an extremely active or playful cat. He has always been calm, laid back, and observant, and wise. So for him returning to his usual routine, resting comfortably, walking around when he chooses, eating well, staying close to me, and supervising everything around him. His July blood work was largely reassuring. His red blood count cell, hemoglobin, white blood cell count, and platelet count were within the laboratory reference ranges. His kidney values, including creatinine and bun, and the measured liver enzymes, were also within the listed reference ranges. His reticulocyte count was evaluated, which his veterinary team could interpret in the context of his recent surgeries and overall condition, but he was not anemic. We will continue watching him closely because he has a history of developing mast cell tumors. The fact that his removed tumors were low grade and completely exorcised is encouraging, and the fact that no cancer was found in examined spleen or liver tissue is wonderful news. But it does not mean that we will stop monitoring him. If another lump appears, it will need to be evaluated. His veterinary team has explained that if he continues developing additional mast cell tumors, we may eventually need to discuss medical oncology treatments such as chemo. For right now, however, he does not have evidence of internal mast cell cancer in the spleen or liver samples that were examined. This experience taught me how complicated cancer care can be. There were moments when we had encouraging information, moments when we still had more questions than answers. There were surgeries, diagnostic tests, pathology reports, oncology appointments, phone calls, medication schedules, incision checks, ultrasounds, and many nights when I watched him closely because I was afraid something might change. There was also guilt. Even when making decisions out of love, it's painful to watch your family member go through surgery. You cannot explain to them that the discomfort is temporary or that you are trying to protect their future. But every time Mr. Jenkins ate or walked towards me or settled down beside me, I was reminded of how and why we went through this. He deserves every chance we can give him, and I'm incredibly grateful that his outcome was much better than when I feared this process began. Today, he is recovering and doing well, and still the same quiet wise old man who inspired Philly Jenkins Rescue. This does not erase what he went through, and it does not mean that we will never face another medical concern. But today, we can celebrate the fact that his known skin tumors were removed and that the examined spleen and liver tissue did not contain cancer, and he is healing. Sometimes, especially in rescue, we become so focused on the next emergency, we forget to stop and recognize these victories. This is one of those victories. So I wanted to make this video because so many members of our rescue community have followed Mr. Jenkins' journey, asked about him, prayed for him, and shared his updates and genuinely cared about him. Thank you for loving him. Thank you for understanding that rescue does not end when an animal is taken off the street. Rescue also means providing veterinary care, making difficult decisions, sitting beside them during recovery, and staying committed through every uncertain moment. I will share Mr. Jenkins' complete rescue story in another video, including his years outside, how he came into my life, and how he helped become the heart of the Jenkins Rescue. But for today, I wanted our community to know that Mr. Jenkins made it through surgeries, and his final internal pathology showed no cancer in the spleen or examined liver tissue, and he's recovering well. Mr. Jenkins has survived the streets. He has survived many surgeries. He has faced cancer, and through everything, he has remained gentle, patient, and trusting. I am so proud of him. Thank you for being a part of his journey and part of the rescue community. Please subscribe to our channel to share Mr. Jenkins' story and continue supporting rescue cats who deserve the same opportunity to receive medical care, safety, and a loving home. We love you, Mr. Jenkins, and we are grateful that you are still here.